again, first thing we're always gonna look, we're just gonna look. I'm gonna look at her hair, I'm gonna look around, I'm gonna say, okay, it's evenly distributed. You know, I was doing Jackie, so I put her texture is thin. It would be totally whatever your partner's was. I would say, do you dye your hair by chance? It'd be yes or no. Okay, hair is natural color. Do you have any hair loss? Have you seen any hair changes? Okay, then I'm gonna ask, do you mind if I touch your head? No. So I'm gonna go in, I'm just gonna touch. I'm gonna say, okay, you know, what was it?
Scalp is...
Right. Scalp, there's no rashes, there's no lesion, her skull is firm, it's normocephalic, the word that they like. No movement, it's symmetrical, it's smooth. Did you have any tenderness or headache? Okay. So now that would be it for that. So now we're gonna go to the face. I'm just gonna look, again, I'm gonna say, you know, look at everything over, color looks appropriate, no facial hair, you know, no acne, no, you know, lesions, no anything like that. No edema, and then I would test, what did I put? Cranial nerve 5, trigeminal. What's the trigeminal? What do we test?
Looking.
Oh, sorry. That's again, that's when I would touch here. It's trigeminal nerve 5 is chewing.
So open up your mouth. Open up and close your mouth.
Open up and close.
And you
and
can't
you're gonna move
clench
from
your
side to
teeth too.
side. I say, okay, you know, there's no grinding, there's no whatever.
Yeah.
What else is supposed to be that? No grinding or anything.
Grinding and no...
And that is, you could say that cranial nerve 5, the trigeminal nerve is intact. Okay. That's the sensory part, but we don't do it. That's with the light touch. Now I'm gonna look at you. I'm gonna ask you to smile, frown.
How do brown?
Pout.
Basically.
You know, puff up your cheeks. Raise your eyebrows.
I'm Asian, we don't really.
Okay. And then I would say, okay, facial cranial nerve 7 is intact. And movement is bilateral and symmetrical. And then I would go to palpate the sinuses. So I feel here, and I would feel up here. I say any tenderness. So sinuses are good. So I would say they're clear with no tenderness. And then I go to the neck. Now I'm going to inspect the neck. I'm going to look. It's going to be normal color. No deformities, no scars. You walk around, no lesions. And then I'm going to say, keep your neck straight. I'm going to look. All of her curvature is normal. There's no scoliosis or whatever they call it.
Yeah.
No nodules. Again, no swelling, no edema. I'm going to ask you to turn your head to the left and to the right. Left, right. I'm going to and right now we're looking at the sternomastoid muscle, the trapezius. And you're going to move your neck down and move your head back. So she has good range of motion, or your shoulder to your ear on both sides. So that's your range of motion. What's the other one? Any tenderness with that. So she has no limitation of movement. It's smooth, it's controlled. Now we're going to, you know, lift up your shoulders. Try and push it down. Perfect. We tested
Cranial nerve 11.
11, which is spinal
Spinal.
accessory. So spinal accessory nerve is intact. Okay. And then that was neck. So now we're moving to lymph nodes. Again, you're gonna say, I'm gonna touch you. So it's pre-auricular, post-auricular, occipital. Then you're gonna go to mandal, submental.
Submental.
Submental, submandibular. Yep, we're gonna go digastric. Then we're going to go to superficial cervical. Relax this hand, then you're gonna go all the way down, and that's gonna be your deep cervical. Then you're gonna go to posterior cervical, and then you're gonna go to supraclavicular. Lymph nodes are intact, none are swollen, doesn't indicate infection. And then, where are we gonna go?
Posterior cervical. You forgot those.
Yeah, posterior cervical are here.
No, posterior cervical are back here.
I
Is that on
I thought they were right here.
Yeah.
Posterior
Occipital.
occipital is up more,
Occipital.
right here.
Post-auricular. Pre-auricular.
Mm-hmm.
Then it goes post-cervical is back here.
Also on the book that has them back here,
Okay.
but this says superficial cervical, and then deep is down the front because it's a chain that runs down.
Yeah, it actually runs underneath.
Under this stuff.
Sorry, I just.
That's okay. No, this is learning. Like I said, I was just going by the picture in the book. Doesn't mean it's accurate. Very bad. So then we're gonna do the thyroid, so we're gonna go behind, sorry, excuse my cold hands. Or you can put, right below at the trachea. So then go ahead and relax your neck and put it towards your shoulder, lean to the right. I'm gonna push, and then I'm gonna palpitate here. Perfect, okay. So there's gonna be no swelling, any tenderness, no nodules. And then, what's the other one? So when you're back there and you're doing it, you wanna ask them to swallow. And if they swallow, then that's doing, hi,
Go right ahead.
that's okay.
Just came to check.
So when you swallow,
vagus.
that's
The vagus,
the
right?
vagus nerve, so that means that
And that's when
intact.
you
Question about
Yeah.
where
swallow.
Swallow. So then you feel it, and then the vagus nerve is intact, and then that's that. That's the end of that one.